Joe?
Sorry, I will in a bit. Thank you, yeah.
All right, welcome back, everybody. We are, if you were thinking about how we were gonna. Uh-oh.
I'm gonna get out of here, hold on. Right, where?
Robin, you're right. I hope her screen is doing it.
What?
Turn off your sound.
All right.
Okay, are we all?
Sorry.
Good.
All right, welcome back. We're going to, if you're following on the agenda, we are running behind on it. But again, we are also talking about in the 230 block, the governor's proposed 2024 budget, which is actually what we're hearing from both the Land Access Opportunity Board and now Molly Dugan is here. We've met Molly, and she is here to talk about SASH and SASH for all, for folks who, well, if you could just give us really a quicker thing on SASH, because SASH has been around for 10 years. I'm not sure if everybody knows about it, but SASH for All is a pilot program that you wanted to tell us about it and ask us to support it in the budget. So I'm not gonna leave you to do this in 8 minutes. You can take your time and explain, please explain this to us.
Wonderful. Thank you, Chair. For the record, my name is Molly Dugan. I work at Cathedral Square, Director of Policy and Strategic Initiatives. I've been at Cathedral Square for about 13 years now, and my first position was I was founding director of SASH, which stands for Support and Services at Home. So I did that for just about 11 years. So what I am going to do in the time together, which I know is going to be pretty quick, I am going to start with a quick summary of what SASH is to bring us all together on that. Then I'm going to jump into this, what we consider a really innovative expansion of SASH to work and partner with younger adults and families with children. And then I'm going to just give you a quick update on the 2 SASH for All pilots that have been happening since September 1st. And then I'm going to present a budget request that I'm hoping you can support. So first off, SASH is a model that we started going statewide with in 2011, and it serves primarily older adults and adults with disabilities, funded primarily by Medicare dollars originally, and then folded into the all-payer model. It's a partnership-based model where we have housing staff that are in 21 different nonprofit affordable housing organizations across the state. We've served over 12,000 Vermonters since its inception about 12 years ago. We target, basically folks living in subsidized affordable housing, and we work with them both individually and with the entire community. So it's a population-based program. So you're not just putting out fires, but you're working on prevention and working with the needs of the entire community. I want to underscore that SASH is a proven model. It has been evaluated independently over 5 years and has shown statistically significant reductions in the growth of spending in Medicare and Medicaid, specifically around reductions in ER visits, inpatient hospitalizations, specialty physicians, and better management of chronic conditions. So it's a proven model that has been rigorously evaluated against a control group. Okay, next. Basically what SASH, so what actually happens for people that are in SASH? They are supported, so basically the participants of SASH are in the center of all the support and care that is provided. So they are getting support around setting goals for themselves, setting action plans, helping around what resources to reach out to, and it's all coordinated around them. And they have access to a part-time wellness nurse where they live, a full-time coordinator, care coordinator, also referred to as community health workers. And there is a formalized team structure with the staff at the housing and then the community providers in the area. And there's a formalized memorandum of understanding with all of those partners. And then monthly they get together. Pre-COVID, it was face-to-face. Now it's a mix. Next, I want to make sure you understand that we have an entire statewide infrastructure for SASH that has built over 12 years. Cathedral Square is the statewide administrator. We get funding from the state. Thank you very much for doing this statewide administration. And we have regional leaders across the state in the housing organization. So those are the ones that you see. And then I know there's a whole list of partners here, but what's important for you all to understand is that in each of your communities, hopefully you're seeing organizations you recognize because they've all signed on to this formalized partnership to work in collaboration and to not be doing lip service to partnership anymore, but to say, this is what we're going to do. We're going to do it regularly, and we're going to do our best to serve our shared clients as much as possible. So we have, as I said, we have 21 housing organizations implementing SASH, but they're working in tandem with all of these partner organizations. There's 68 of them across the state. So now moving on to SASH for All. So going beyond the traditional model that serves older adults and adults with disability was a very natural evolution. Understand that the 21 housing organizations that are doing SASH across the state house many, many more younger adults and families as well as older adults. And Cathedral Square our niche happens to be older adult housing. So this was brought to us as, let's expand, because this model is working so well with the older population. We know it will work well with younger adults and those with children. So we've spent the last about 3.5, 4 years planning for this pilot with a group of partners. And we, as I'm going to tell you about, we've piloted it finally. Our mission with SASH for All is that we partner with participants and families to coordinate and deliver individualized support where they live. So again, this is all emanating from where people live to increase their resilience, strength and well-being, improve health outcomes, and build their community, a community of peers. This should look really familiar because this is the same graphic that I showed you about traditional SASH. So it's based on the core elements of the SASH model that has been proven to be so successful. The difference here is that you can see we're serving families, so even families with kids. We're also not only having a SASH wellness nurse working out of the properties and the care coordinator, but we've also added in a mental health support person in the housing as well. And that's the peer support advocate. So that's not in the traditional SASH model, but it's something that we heard loud and clear in the planning phases for this. So that would be a really helpful embedded position. And it is a position that the housing organizations will contract out with their designated agency for their region. So like the Howard Centers, or in this case, HCRS is the designated agency.
HCRS.
HCRS is healthcare and rehabilitation. I wrote this down, and you're going to ask that. I did. I wrote it down. Healthcare and Rehabilitation Services.
There you go.
There it is. So that's their designated agency, mental health and community agency. So moving on, as I mentioned, it's based on the same core elements of SASH, which is that you have staff based out of housing, congregate housing in particular, affordable housing. You use a person-driven, strength-based approach. There's an all-in. So the staff are serving not just an individual person and another individual person, but the entire population that lives in that particular community or in that kind of grouping of scattered site buildings. But staff have a certain population that they're working with. There's individual planning and goal setting. And then there is, again, that hugely important component, which is this is a partnership model. We're not doing this all on our own at all. I wanted to make sure you understood that we are in the pilot of SASH for All. In the planning process, we have developed a very, hopefully this visual lets you see that's a very kind of detailed evaluation framework. We wanted to know what we were trying to measure from the beginning. And so this was after a lot of research and talking with the state and lots of other programs around the country, and doing a lot of research on what housing and services programs have worked. We came up with this framework. We're going to be piloting this program, so might these outcomes and inputs change? I certainly hope so. That's the whole point of piloting things, is you give things a try and you pivot when necessary. But overall, what I want to point you to is the long-term outcomes we're expecting from this expansion of SASH for All is increased housing stability. This is the long-term benefits. Decreased healthcare spending, which is exactly what we saw with traditional SASH. Increased educational attainment, improved chronic disease management. And, it's important to note that chronic diseases are not just for older adults. Chronic diseases start when people are much younger. Or, imagine this. What if we worked with people to actually prevent them from ever getting diabetes or hypertension, those kind of things? And that's the focus of going down, one of the focuses of going down to younger populations. And then decreasing the use of emergency shelters and improving financial security. So that's kind of big picture outcomes that we believe are absolutely attainable.
Molly, before you go on, can you tell me I don't have the slides up on my computer. Can you tell me what's in the upper right-hand corner of your slide?
Ron,
Because up on the screen here, it's just.
all successful outcomes.
Oh, yeah, there's nothing underneath.
Yes.
He's our ace in the hole.
Financial security. Huh?
Okay.
He didn't hear a word of that.
No.
Actually, I did.
Okay.
You're just pointing out that the long-term thing points to you. So, no, just a question. Can you go back to that one thing? So
Yeah.
I just want to go back to like the inputs, and, like 1.1, one-on-one sessions for trust building. Now, I'm old enough to remember discussions when I first got involved in programs like this or in my community, where the distrust came in from the fact that the state was coming to my house. They were going to open my fridge and tell me that I was eating bad. There was the distrust came from, and that goes back much further, right? That kind of distrust of the government goes.
Right.
It was very much a part of the Abenaki experience,
Right.
through the 10s and 20s and 30s, and so this is not that though. What's the difference between what people think it might be and what it is?
Okay. Yeah, no, great question. Number one, this is completely voluntary. It's not that, if you happen to live in one of these subsidized housing communities that has SASH for All, that you have to participate. Absolutely not. It's completely voluntary. Our staff that are working in these buildings, what we tell them is their primary function is to get to know their residents. Like that's job duty number one. And that's having lots of FaceTime, lots of social events, lots of just being available. And so it's all about relationship building. And then it's, hey, let me tell you about this program, what we're trying to do. We need your help and to help us design it. So really getting ownership of the program by our residents. And that's always been a tenet of SASH. When we piloted SASH 12, 13 years ago now, we came to the residents and said, we have this kind of maybe crazy idea. Would you spend a year with us to design something to meet your needs? You guys know what your needs are. You're the experts. So that's the same theoretical framework that we bring forth, and we train our staff in motivational interviewing and relationship building so that they have the tools to put the power and the ownership into the residents. This is their model. This is their program. So I really think that power shift is what works. It's not, nobody's required to do anything.
Thank you.
I wanted to just touch upon the statewide administrative structure, because when we're asking you to support our budget request, I want you to understand that there is this existing framework of oversight and administration that has been in place already because of the traditional SASH model. And SASH for All would be folded in to this administrative structure. And what Cadito Square is the statewide administrator. We are charged with providing all the staff training across the state. So there's 21 organizations that run SASH. They rely on the staff at Cadito Square. There's a small administrative team to do all the training, so it's consistent. There is onboarding training for new staff. There's continuous training for professional development. We have a statewide data management system for all the assessment data that comes in across the state. It's called Population Health Logistics. We run that out of Cadito Square. We send data back to the staff all over the state, absolutely on a monthly basis. And then whenever they want specific data reports run on their populations or panels, we do that. So it's not just collect data for it to sit up somewhere and, respectfully show bodies like yours, but we actually use it to give back to our staff so they can then make changes and pivots in their programs based on what the needs are that they're seeing in their entire community. So that's really important. We have a quality assurance and improvement program. What that means is we go out and do site visits and audits on an annual basis to make sure the model is being run as it was developed over these past 12 years. We also have then technical support and resources for staff. We have a large, what's called an intranet, where there's best practices, programs, all kinds of things for our staff. So I just want you to understand that there is an existing administrative structure that allows for scaling up of pilot programs. So let me just tell you a little bit about the two pilots that have launched for SASH for All for this expanded program. It is happening down in the Brattleboro area. One of the housing organizations is Brattleboro Housing Partnerships, which is one of the public housing authorities in the state. They're also one of the SASH regional leaders for the traditional SASH. And then the second organization piloting SASH for All is Wyndham Windsor Housing Trust. We have the program available at 11 congregate housing sites in the area, 2 at Brattleboro Housing Partnerships and 9 at Wyndham Windsor. And the Wyndham Windsor Housing Trust sites are more scattered in nature. So they're smaller, affordable housing sites, whereas the Brattleboro Housing Partnership ones are larger, more kind of traditional congregate buildings. So they have just larger volume of people. Yep.
So are these SASH for All, is it replacing existing programs? Or is that a filling a void at these housing sites?
Okay, great question. Definitely not replacing any other programs. What we see is SASH for All is adding value to the continuum of supports that are available by utilizing the housing-based nonprofit network as a platform to kind of have the services and supports come in where people live. So it's using these housing sites that have already been funded federally and then funded with state dollars through VHCB to have affordable housing across the state. And it's saying, well, what else can we do in these buildings that have been publicly funded to add even more value? And what we realize is it's on the services side, where there is just a need for better collaboration, more intensive kind of presence for people in these housing sites. And so it's really just certainly it would never be like, oh, you get SASH for All, therefore you don't get this program. It's all encompassing. It's like, oh, you're on SASH for All, so we're going to make sure that you're accessing this existing program that's perfect for you, but you may not have realized it yet. You may not have understood that that was even out there. And by having staff in housing where people are seeing them day in and day out, they're able to have those conversations about this is where I'm challenged, this is where I want to go. Can you sit down with me and help me figure out a plan to get there? So I really see this kind of just broadening out this.
So it's connective.
Very connective, yeah.
And it is for primarily people who are in affordable housing.
Yeah.
60% of area median income and below.
Yes.
Primarily.
Yep, and perpetually affordable housing. And primarily funded through the HCD and many other sources,
Right,
like
but
housing
they're-
credits.
Right, but they're the core thing. And
Yes.
Brattleboro Housing Partnerships, is that their housing authority?
Yeah, that's their housing authority. Yep. Really good question. Okay. So I just wanted to give you a quick update. So remember I talked about this is a partnership-based model, so all the memorandums of understanding are in place with this pilot for SASH for All, and the partners are, the two housing organizations plus the designated agency, which is healthcare and rehabilitation services. Brattleboro Memorial Hospital is a partner to the SASH for All program. Winston Prouty, which is a parent-child center in the area, and Turning Point is a organization that supports people with substance misuse disorders. So one thing that's interesting is the partners coming to the table are not the same as the partners that have come to the table for traditional SASH. So with traditional SASH, we've had the area agencies on aging as a core partner, home health agencies, just slightly different partners. So, which makes sense. All of the staff positions have been filled. We launched this pilot in September, with the exception of the mental health position. It's a half-time position. That's just been because of workforce shortages. HCRS, which is a designated agency, has been working really hard to fill the position. What they've done in the meantime is provide an existing staff member to spend a day a week on SASH for All with the two housing organizations. So we're going to get there. It's just given the current workforce environment and the resource constraints in the designated agencies, it's what it is. All the staff have completed really rigorous multi-week training in SASH for All. They've also completed a 6-hour evidence-based program on working with families called Strengthening Families. Staff are busy, as I said, building relationships. They're enrolling participants that want to participate. We have 40 participants to date, which we're really happy with that. We really didn't know how quickly it was going to ramp up, if we were going to be able to get people's trust. And we feel like we're on target. And SASH team meetings are happening on a monthly basis. This is our SASH for All staff down at Wyndham Windsor Housing Trust. So I put pictures of some of the things I'm talking about. This is one of the community building programs that happened just recently with Wyndham Windsor Housing Trust. They did a great program right before Valentine's Day that was geared towards kids, but it was really saying, we know you have to make all your Valentines for all the kids in your classroom, which can be super stressful for families. And so they did it and had all of the different art supplies available. And not only did a bunch of kids come down from the buildings, but the parents did as well. And it became this really, what I've been told, really great event where neighbors met each other for the first time and really, just had time together. And this is part of the model, which is about community building and making sure you're building that kind of resilience in the community so they can rely on each other for support and help. So these are some photos from that event. There's just some success stories. You guys have this, so I don't want to dig too much into this, but there's some really incredible success stories that have happened already. And again, we only started this in September and spent the first 6 weeks on training. One that was, I thought, really powerful had to do with enrolling a couple in Green Mountain Care during open enrollment season, where they had been both the people in the couple had been working at local restaurants. They didn't have health insurance, and they had been buying into private health insurance. And then one of them became disabled, and suddenly they didn't have any health insurance, and they just hadn't been aware of this program. And so the SASH coordinator sat down with them, got them signed up, and they're paying 12 cents a month for the whole family for health insurance. So amazing what happens when there's people nearby that you trust. Okay, now, I also, of course, there's challenges. There's challenges with every new initiative. So I wanted to throw some of those out. I already mentioned this, finding the mental health support staff has been hard. I think we're going to get there. It's just taking a little longer than we thought. What we're hearing from staff on the ground is that social isolation is one of the main struggles that their participants or potential participants are struggling with. So again, building community is high on the priority list. As I mentioned, Wyndham Windsor Housing Trust has 11 different properties where they're providing this model. And, they're finding that because they can't be there all the time, like if you're just at 2 buildings, you have a lot more face time, that, makes outreach and trust building a little bit slower. They're still feeling good. I said they're the ones that did that Valentine card party, so they're figuring it out. And the truth is, we have scattered site affordable housing all over the state. We're a rural state, and we figured it out with traditional SASH, and we're going to figure it out with SASH for all as well. I wanted to tell you how we're funded currently. So the pilot, we have funding for 1 year, and it was funded through a congressionally directed spending request, also known as earmarks, or used to be known as earmarks, through Senator Sanders. And it's a 1 year funding, and its projected end date is August 31st of this year. So, and then I wanted to, present a budget. This is a budget request that we're looking for support from your committee on. And we have basically built the request from kind of the per panel expense up. Okay. So we've estimated what it costs to run one SASH for all panel. And then we said, well, if we could scale it up, what makes sense over the next number of years? And so we came up with an estimate of 5.4 million. Which would provide for continuing of the 2 existing pilots that are happening in Brattleboro area, and then adding 10 more and making sure they are in all those different regions of the state. So again, that we would have statewide reach. So there'd be at least 1 pilot or SASH for All program in each of those. And we are asking for 2 years worth of funding. We find that with pilot programs like this, there's, just a lot of work up front and training and, pivoting on things and learning that make it really impossible to be able to show substantial outcomes in 1 year. So ideally we'd have 2 years worth of funding, and this would serve about 1,000 people. I did want to make note that this SASH for All expansion is included in the Bridges to Housing proposal that I know your committee got in early February that includes a host of different strategies to get us from kind of pandemic related housing infrastructure to kind of what's next. And SASH for All is included under the strategy of bringing proven permanent solutions to scale to reduce homelessness. We absolutely believe SASH for All is a homelessness prevention model. And there's other, wonderful support models as well. So we're not saying this over any others, but there's a lot of really wonderful programs within this proposal.
Representative Burrows had a question.
Yes.
Yeah, thank you. It's just a quick question, and that is it 1,000 persons over 2 years?
Yes.
Or 1,000 people for 2 years?
It's 1,000 persons for 2 years, over 2 years.
Over 2 years or for 2 years? So 500 a year or 1,000 times 2?
I know what it is. So a panel serves roughly 100 people. So if we did 12, I believe it's, and I'll correct myself when I go back and do the math, but I did this math, I'm just not remembering right now, but it's 1,000, over 2 years, we will have served 1,000 people.
Okay, thank you.
And if I go back and look at my back of my envelope, I'll let you know if I was wrong on that.
Representative Ladonna.
Thank you. Is that budget for the 2 years or for each year?
For 2 years. Yeah. I tried so many ways to write this, and I was like, it's just confusing, isn't it? Yes, the 5.4 million is for 2 years.
Okay.
And it roughly comes to $225,000 per panel of participants, and that's roughly 70 to 100 participants. So it's for those of you that are quick with math, you can probably check me real fast. 225 per panel, 12 panels. And it gets you a lot more than just the programs in the pilot. It's again, the fact that we have this existing administrative infrastructure and housing leaders across the state and established partnerships across the state. So it's not, there's just a built-in support structure that I think is important for you guys to understand.
Okay.
Any other questions? Hope I didn't go too fast.
No, you did great. Questions right now for Molly? I mean, having worked with an organization that was one of the local Central Vermont's,
The designated
coordinator.
regional housing organization, or a DRO.
right, and it, you know, I think I saw it from the very beginning and how it grew. And so it's just, it's a fabulous program for those who can have access to it and those who utilize it.
Thank you very much. I really appreciate your consideration of this, and thank you for all the support for SASH in the past and the investment in the affordable housing. That's what makes this happen, is that we have that foundation across the state of affordable housing providers.
I'm sorry, I do have one, just looking at this map. Does each of the stars represent a housing facility which has SASH?
Which has SASH emanating out of it,
It's
yes.
not a partner.
No, there's 140 around. There's actually more than that now, because I haven't been the director for 2 years now, so I know they've added some more SASH sites. But when I used to talk about this all the time, there were 140 specific congregate housing sites where SASH was available. This is the traditional SASH model. Now we have, these 11 that are doing SASH for all. So it's quite comprehensive.
I like the geographic distribution.
Yes, absolutely.
And just last question for me, I used the word connective earlier, and I don't want to diminish that SASH is only about connecting people to existing resources, but when we talk about the three-legged stool, we talk about the need for the housing, we need, the funding for the housing and for the services to support the people who are in the housing. Without this, we make an assumption. You also said, well, the clients, the residents are the experts, but they can't be experts if they don't know that the programs exist.
Correct.
And I just think that that's where, yes, you provide other services, you provide not house calls, but virtual house calls.
Yeah, the wellness nurse does blood pressure clinics and coaching on chronic disease. But what I was trying to say is that the participants are experts on what they need, what their unique situation is, where their challenges are, where their opportunities are. And that's what has to be tapped into for then there to be an appropriate connection to what exists out there. And if something doesn't exist, well, then how do we figure out how to make it so that you're getting the support you need? So, but the fact that it's the participants and the residents that are driving the goals they want to set for themselves and the action steps they're willing to take and the kind of duration of support they want and the intensity. Some of them want you to back off, and they want you to do something very different than you might on the surface think is their challenge. And this is what we train staff on. It's not about what you think you're seeing as their challenge. It's what they name as their challenge.
So it's 140,
140 existing SASH sites across the
and
state.
each panel that you call them.
There's about 100 people.
So, but the locations may not add up to 100. So
Absolutely not.
you can't say it's 14,000 people.
You cannot.
Right.
Don't try to do that math. It gets very confusing, especially up in the Northeast Kingdom. You'll have panels of 100 that are 13 different housing sites are making up that 100 people. So, Rural Edge, which is the SASH provider up there, their staff is driving all over the place, serving folks and doing a fantastic job. But it's challenging
I think Representative Flavor can look at Canaan to where, and just go, that's my district.
Yeah, and that's one organization that is
Right.
providing that and doing just a
My
bang.
father was a beneficiary of SASH.
Fantastic.
All right, further questions for Molly? All right, thank you so much for coming in.
Thank you very much. Really appreciate your time.
So committee, what we'll do, we have three folks coming in on H-157, which was the act relating to the Vermont Basic Needs Budget. What's gonna be in front of us is, so just some further testimony. We've heard from Ellen Kaler originally, we've heard from Dan Dickerson. They're just gonna give us an update and answer any questions we have about the process. Austin Davis from Lake Champlain Chamber is also gonna come in and talk to us and share some thoughts that he's had over the course of time about perhaps a different way of looking at how to get to a basic needs budget. And it's something that we'll work on this afternoon. And I'd like to be able to make some decisions on this, get some thoughts about whether we should move forward. I mean, essentially, it's telling a group of people to get together with JFO. It's a summer study committee, basically, a form of summer task force, whatever the language is in the bill, to reconfigure the process by which they would develop the basic needs budget, which would then, I believe the way that the language is written is that if they were finished with it by a certain time this year, it could get approved for work starting next year through the joint fiscal council, rather than having to come back to us. If the joint fiscal council is uncomfortable with moving forward, then it would come back to us anyway, in January. So that's what's there. As far as the proposed budget is concerned, I think the best use of our time will not be to ask Damien to talk about it, but to come up with, I think what I'd like to be able to do is I'll check in with Damien after we're done, time permitting. And he and I will go over the list of people that we've talked to. We'll go over the spreadsheet that we were given. So the spreadsheet has direct material that we talked about last week. We're probably only going to respond to 3 or 4 of the issues that were on the spreadsheet. But we have also heard, and tomorrow we can talk about this in greater detail, we've also heard now from a number of witnesses, and we'll hear from a couple of more tomorrow, who want us to make a comment on their budget requests, and we'll go over those. For instance, SASH, for instance, the Land Access Opportunity Board, and we'll go over those with and just have a conversation. But I think I want to set up a different. I'm finally getting an idea of what I want the budget memo to look like, but I want to talk to Damien about it so that the two of us are on the same page, that we can present to you. And then we'll work on that we've got a busy witness day tomorrow as well. So, but for now, we're not scheduled to have anyone in until 3:15. And I don't see them here, so let's take a break until then. You're the person on this, right?
On 3:15.
Ed.